He was a urologist, a surgeon by training, but really he was an incredible advocate for patients, particularly people who are poor and people who are underserved. His whole goal was to make people aware of their capacity to care for their own health, and so he believed in education and educating the community about diseases, about risk factors, about controllable risk factors, and about being responsible for your health. Don't do everything for people, but lead them and then pull back. Lead them a little further and pull back. And pretty soon they're caring for themselves. The Ethnic Health Institute was founded in 1997 by the chief administrator of the hospital, but it was at the request of physicians. Dr. Staggers, of course, leading the group. And the purpose of the Ethnic Health Institute was to reduce, if not eliminate, disparities in healthcare and disease among underserved and minority populations that experience the disparities. And so Dr. Staggers, trying to do something about that issue, decided that the focus of the Ethnic Health Institute would be on the poor, on the disenfranchised, on the vulnerable, and teach them about their health, screen them, navigate them to a health provider.
He liked to tell stories, and I think one of my favorite stories was what he recalled his Navy days, and he talked about how the fleet had to move forward, and they had to move together, toward a bigger goal. So they had to agree on the goal, and they had to all move together. It's all row in the same direction at least, and while we may have disagreements, we still have a goal. And I think his goal was to bring better health to everybody, not just his own patients, but to his community. WNEPO, the Network of Ethnic Physicians, was something that I think Frank and his very close friend Rollin thought about, and they thought about how there are many ethnic physicians out there practicing in communities, but there was no leadership, and they weren't necessarily always going in the same direction, the fleet type of example. And so he thought that to bring them together, because they had these different ethnic physician groups had, and in many respects, the same interests. Bringing better health to a disadvantaged community, a community that had, culture issues and language issues. And so he was able to bring that forward in an organized way.
Well, he and Rollin were both very much involved in the creation of a subsidiary organization of the foundation, which is NEPO. And one of the issues that exist in many ethnic subgroups is that they have a dearth of availability of healthcare providers that are indigenous to those groups. And because there was no organization there, the healthcare needs of these various subpopulations were not effectively being addressed. And he was involved in identifying that need, and that was the need, I think, that Frank saw, as well as others in the foundation leadership. And they put together an infrastructure base to bring them together as a group. And that didn't happen on its own. It happened because people like Frank understood the need, understood the opportunity, and worked to make it happen.